So I was right, and there was a part 3. And we're going to now look at the different divisions of the skeletal system. This is going to be the part that kind of mirrors what we do in lab, but it's really good to have that repetition, all right? So hopefully this won't take too terribly long of a lecture. There are a lot of slides, but I don't think it'll be too long. So we talk about how many bones there are, but truthfully, the actual number of bones in the human skeleton can actually kind of vary. There are typically about 206 bones. We divide the skeleton into 2 portions. We have what we call the axial skeleton, which is going to be kind of along the body's axis. It's going to contain the skull, hyoid bone, thoracic cage, vertebral column. And then we have the appendicular skeleton, which is going to be the pectoral girdle, which is going to be this area here. That's the pelvic girdle. Sorry, the pectoral girdle is over here. Upper limbs and then the lower limbs. So basically the shoulder blades, the pelvis, and your arms and legs. So the skull is one of the most challenging portions, I think, to learn, but it's also, to me, one of the most interesting because we think of it as one solid bone, but it is composed of a bunch of bones and a bunch of tiny little bones in there. And that's why I really like these color-coded diagrams here. We have in lab a couple of color-coded skulls. I don't know yet if we're going to be able to get into the lab or if it's going to stay fully online. I told them to go ahead and set it up as fully online, so don't stress if you live far out and it's fully online and you can't get there to do hands-on, then obviously I'm not going to force you to do that, but it's so much easier to learn when you can put your hands on something, okay? And so if you have access to somewhere, or if you're able and we're able to get into the lab to do this, it helps a lot. And these color-coded skulls are really great to have, okay? So this is made of the cranium and the facial bones. And then so we have the frontal bone, and that forms the, let's see, here for you, the frontal bone. This is this orange portion here that forms the forehead, the roof of the nasal cavity, the roof of the orbits here. Frontal sinuses houses them, and then that supraorbital foramen, okay? Supra is the same thing as superior, and so that means above. And you can see we have lots of other different bones here. There are some features pointed out here, like we have the mental foramen, and yes, there's the superior or supraorbital foramen there. So we've got to learn all of those openings as well. And so you need to be studying this every day, especially in summer. We are cramming 12 weeks into 8. Thank goodness it's 8 weeks, not 4. We don't do anatomy in 4 weeks in the summer, even in a normal year, okay? But you are going to have to work your little hiney off to get all this down, all right? So please take me seriously when I'm telling you to study for these lab exams. Even online, they are timed, and there are lots of words that you need to be able to spell correctly. That is important because of things like medical errors. There are some things that are very similar and 1 or 2 letters off, and you're talking about a whole other body part. Okay, so spelling is important. I try to give you a little bit of grace while you're learning, but you need to work hard at learning how to spell these. All right, and so next we have the parietal bone here. There is right here on your head. We had frontal here, which is in the front, so that makes good sense. And then parietal here, and this is the blue portion here in this picture. It forms the side walls of the cranium, the roof of the cranium, and it contains the coronal suture. Coronal suture kind of refers to crown, like a crown that goes this way. All right, and so here's the coronal suture, and then it also helps form the sagittal suture as well. So the occipital bone is at the back of this skull here. You actually have what we call an occipital ridge, and that is this bluer purplish portion. I guess that's really more of a purple there. It is the base of the cranium. You need to stop when you are looking at these diagrams and think about what view this is, okay? Superior would be looking down from the top. We've been looking at some that were lateral, and this is, oh, I've just had a moment. This is the inferior, or you could almost say ventral, but really the inferior portion. So if you take my head and flip it over and then look down, that's what you're looking at. All right. So you need to kind of orient yourself when you're looking at these, because different structures look different from different orientations. So stop and pay attention. There are some websites, and I'll look and see if I can find them, where you can kind of rotate and look at things in 3D. Try to do that, because they do look different from different perspectives. All right. And so it forms the base of the cranium. It contains the largest opening in the body, the foramen, or opening in a bone, I should say, the foramen magnum, which is this section right here. And what do you think goes through the foramen magnum? If I put my head down right here, what is going through that? Well, that is where your spinal cord comes out, okay? Then you have the occipital condyles here, which we will learn about, and the lambdoidal suture. It helps to form that as well. And you can kind of see that along here. It's kind of makes almost an L shape when you're looking at from a lateral perspective. So next we have the temporal bone. It's a set of two, one on each side. And you can see this here is kind of red in color here. Okay, temporal bone. This forms the side walls of the cranium and part of the floor of the cranium as well. And also part of the floor and sides of orbits. We have this squamous suture here, and you can see that here. It almost makes an S shape, so that can help you remember squamous. It contains the external acoustic meatus. Meatus is another hole for a more for a more tube-like opening is what a meatus is. Acoustic has to do with hearing, and external means outside. So this is the opening of your ear to the outside for your eardrum and all. Well, not for the eardrum, but in the bone that allows the auditory canal to go through, to get that sound through. Then we also have the mandibular fossa. A fossa is a depression. We have the mastoid process we can see here, and this is the more rounded shape, and then the styloid process right here, and then the zygomatic process portion of the temporal bone. That is what kind of connects to the zygomatic bone. And so remember, process is an extension on that bone. The sphenoid is an interesting bone. It's kind of one of my favorites. It looks a lot like a butterfly, and I used to collect butterflies, so I kind of like this one. It helps form the base of the cranium, the sides of the skull, and this is actually inside. And you'll see probably in lab, even if we don't go in lab, you'll see on the PowerPoints, it's like a little yellow piece, okay, that fits down inside. So it forms the floors and sides of the orbits, or helps form. It contains the sella turcica and the sphenoid sinuses. The sella turcica means Turkish saddle, and it's this little ridge-like thing that goes like this, and it looks kind of like a Turkish saddle, so that's where it got the name. Ethmoid is a very small, oddly shaped bone, and if you haven't noticed here, these pictures here, this is kind of showing you from a superior view of a cross section. So you're looking down in the base of the skull, and this dark portion here is where you would find the ethmoid bone. And so you don't usually see it like this. And when I do test on it, I tend to test on it as it is in the bottom half there of the cranium. Okay, so this helps form the roof and walls of the nasal cavity, the floor of the cranium. I said roof, but it is technically the floor. It's on the bottom. Did I say roof? It's on the bottom. It has what we call the cribriform plates and the perpendicular plate, the superior and middle nasal concha that you can kind of see also from an anterior perspective looking in. Contains the ethmoid sinuses and what we call the crystal galli, which is kind of a raised portion on the bone. So maxillae is the plural form of maxilla. So this is the upper jaw bone. So this is the maxilla here. This forms the anterior portion of the roof of the mouth. the floor, basically the bottom part of the orbit, sides of the nasal cavity, and floor of the nasal cavity. This contains what we call the alveolar process, houses the maxillary sinuses, and then what we call the palatine process. So this is a good little diagram here. It shows you the sinuses. You can see the frontal sinus, the ethmoidal sinus or air cells, the sphenoidal sinus, which is inside that sphenoid there, and then the maxillary sinus. It's kind of a pet peeve of mine when people have a cold or something and they say, I have sinuses. Well, good Lord, I hope you do, because if you don't, you have a major problem. You might have an infection in your sinuses, so don't ever come to class and tell me you have sinuses, because I'm going to say, yeah, you kind of do. Everybody does. Sinus is basically a hollow cavity. So next we're looking at the palatine bones. I don't focus on these two terribly much, but we do talk about them. The palatine helps, along with the maxillary, to form what we call the hard palate in the mouth. You won't usually see them pulled out like this by themselves. You can see them here. This is looking at an anterior view, so you're looking this way towards my face. This is what you're seeing, so you're seeing this right in here. They're kind of L-shaped. If you look at them loosely, that's an L. They've helped form the floor of the nasal cavity and the side or lateral walls of the nasal cavity as well. Next are the zygomatic bones, and this is typically what we think of when we think of cheeks. So it's just the prominence of the cheeks, and this is where the cheekbones stick out. They're prominent. It does help form the lateral walls of orbits, the floor of the orbits, and the temporal process of the zygomatic bone. Okay, and that's right here where these two bones meet. So zygomatic process in red, temporal process on the zygomatic bone. Seems a little backwards, but that's what it is. Here we have the lacrimal bones of the nasal bones. They are very small. Lacrimation is when you're actually crying. So if you think of lacrimation, lacrimal tear ducts, okay? So this forms the medial walls here. I'm not scratching my eye, I'm trying to show you where. Of the orbits, contains the groove from the orbit to the nasal cavity. So the nasal bones also help here to form. They're in blue. I don't know if you can see that pointer here. So both of these are in blue. You've got your lacrimal bone right here, and then your nasal bone right there, which forms the bridge of the nose. Here we have the vomer. It's right here. This is helps form the inferior or lower portion of the nasal septum. Okay, so the nasal septum is what goes in the middle, down in between your nostrils. Then we have the inferior. So inferior means below. So the lower nasal concha. Remember, we also have a superior nasal concha. And so you can see that inferior nasal concha right there in green, and it kind of sticks out like this if you're looking from the anterior view. So the skull is not completely developed when babies are born, which is really important. They have what we call fontanelles, and these are membranous areas of incomplete intramembranous ossification. So they're fibrous membranes, and we commonly call these soft spots. Okay, these actually allow the skull to be compressed and change shape and be molded, which allows passage through the birth canal. So if it was rigid, you wouldn't be able to apply any pressure and get it through, because the cervix in the birth canal, the cervix will dilate to about 10 centimeters, okay? And especially these healthy babies we have today, their heads are pretty good size. So it allows that head to go through the birth canal. Closure occurs between 2 months and 24 months, depending on the fontanelle. There are 4 fontanelles. You have the posterior fontanelle right here, okay? And so it's going to be more back here. It's smaller. You don't notice it near as much as you do the anterior fontanelle. That one is the one that we're most familiar with. It doesn't close from 1.5 years to almost 2 years. That posterior closes up right away, 2 months. Then you also have the sphenoidal fontanelle and the mastoid fontanelle. And you can find those right here. There's the sphenoidal, is near the sphenoid bone, and then the mastoid fontanelle, which is kind of near this mastoid process there. So be sure you know these. So I'm probably going to make this into 4 lectures instead of 3, but I'm still only at 15 minutes and we're halfway through, so I don't think it's too bad. Y'all can let me know if this is too long of a lecture. Let me know and I'll change it next semester. So we have the vertebral column here. We've got 5 fused vertebrae. Coccyx here at the distal end here. We've got a nice little acronym. Breakfast is at 7, lunch is at 12, and dinner is at 5. And this is how you can remember that we have 7 vertical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. And then we have the sacrum, which is 5 vertebrae that are fused together, and the coccyx, which is 4 little bitty ones that are fused together as well. So these are made of vertebrae which separate from the vertebral column. It separates or is separated by those intervertebral discs, and those are connected by ligaments. It extends all the way from the skull to the pelvis. So I should have told you in the last slide, but the function, of course, is to protect the spinal cord. That is the most important part. And so we do have some oh, never mind, I'm getting ahead here. Okay, so here we have it broken down. You can see the little picture there on the left is showing you with the curvature. I was about to get into talking about the curvature prematurely. And then on the right, the picture is kind of lined out so you can see. If you look closely at these, you can tell that the cervical vertebrae look very different than the lumbar vertebrae, and the thoracic is kind of in between. And they do get larger as you go from top to bottom. And so remember, breakfast is at 7. We have 7 cervical vertebrae. Thoracic vertebrae, lunch is at 12. And lumbar, low back vertebrae, dinner is at 5. So now I'm supposed to talk about the curvatures, okay? So I think it's kind of interesting when you learn about these. You know, we have a curve here. This is called the cervical curvature. And you can see these curvatures here. And so you've got this one going this way, and then you have a normal thoracic curvature that goes this way, and then lumbar going this way, and then sacral that way. That is the normal curvatures. So the primary curves of the vertebral column are thoracic and sacral. Well, what does that mean, primary curvatures? Well, when you're born, you only have those 2 curvatures, okay? You get the other curvatures as you develop, and so we call these secondary curvatures, and these are cervical and lumbar. So I want you to think, when would a baby begin to start developing that cervical curvature? What do they do? What do they have to start doing? Well, they start holding their head up, right? So the cervical curvature develops when a baby begins to hold its head up by themselves. And then I want you to now think about the lumbar. What would predicate come before the formation of a lumbar curvature? What developmental process does a baby go through? Well, they begin to stand up, pull up, and to walk, okay? And so the lumbar curvature develops when you stand. Curvatures of the spine that are irregular can cause other problems. These are the normal ones. We can also have lordosis, scoliosis, kyphosis. So there are some different problems you can have when the spine curves irregularly. Okay, so this is a typical vertebrae, and then you do have differences between, like we said, the cervical, thoracic, and lumbar, all right? So each type of vertebrae does have its own characteristics, but some have some key points in common, and these are those key points, characteristics of a typical vertebrae, all right? So they typically have a drum-shaped body, and so the body here is right here, which is kind of drum-shaped. They all have intervertebral disc, which cushions between the vertebrae. Hopefully you do. If you don't, you have a lot of problems, and trust me, I know. I have degenerative disc disease, and they begin to deteriorate, and you start getting bone on bone. It's just very painful. We also have intervertebral foramina. Now, foramen, we already learned, was a hole. It was a large opening. So when you add the ina on the end, that makes it little. So foramina is a small opening, okay? And that allows nerves passage out from the spinal cord on throughout to the body. Okay, so let's go over the parts of a typical vertebrae. We have the vertebral arch. You can see kind of that here illustrated, the vertebral arch. I'm pointing. So here's vertebral arch here. This is made of what we call the pedicles, laminae, and spinuous processes. Okay, here is the spinuous process here, and this is, you are looking down at this vertebrae. This is anterior, so this is front of the body, and this is what actually, when we feel the spine, that's what we're feeling. Okay, and so we're looking down this way. The front is here on the bottom, and the back is here at the top. All right, and so there is the vertebral arch. Where was I? Let's see. The pedicles, laminae, and spinuous process. So that's the spinuous process. Here is the lamina. Laminae is just plural, so you have one on each side. And then this is the pedicle, which is, I believe, means stalk-like. Okay, so there's short stalks. All right. So that's what composes or makes up the vertebral arch. We have a laminae plate that comes from the pedicles. Let's see. We have vertebral foramen. They allow the spinal cord to pass through, of course. We have those transverse processes I was telling you about. And so these are out here on the side, and for larger vertebrae, they almost kind of go straight out. And that's what I was talking about previously. That I just had snapped right off because they serve as attachment points for ligaments and muscles. We have superior and inferior articular processes. These project upward. So superior, inferior means above and below. And these are where you can have an articulation where something can move. And so that's what these, my pen goes off. These are here where something can move together and articulate together, and this is partially where vertebrae also join each other, basically. So cervical vertebrae, how many are there? How many are there? Do you remember? What time is breakfast? Breakfast is at 7. Okay, so 7 bones of the smallest vertebrae comprise the neck, and they do support the head. So the tiniest ones we have actually support our big old fat heads. Okay, so this is a typical one here at the bottom. You have a transverse process. They are distinctive because they have transverse foramina. So remember, that's a little hole, transverse foramina. This one says foramen here, so it kind of depends on the textbook. Those allow blood vessels access to the brain. That's really important. We want blood flow to get to the brain, right? They have what we call a bifid or forked spinuous process here. They are bifid, meaning 2-branched. Okay, so they're actually forked on the spinuous process. And that's only going to be for the 2nd through the 5th. The atlas and the axis, we will see, have their own little special things. Okay, and that's going to be the top 2 vertebrae. So the first vertebrae is the atlas. And then the second one is the axis, okay? And so the atlas actually sits on and articulates with the axis. And so I think of the axis as the center point of something. And so that's how I keep the 2 straight, is I think about the fact that the atlas has to articulate or move around. I wish I had them right here with me. The axis, all right? So, features that separate the cervical vertebrae from the rest, we already pointed out. Those are the fact that it is bifid. Of course, you can see here the axis is not bifid. It's kind of short and stumpy. And then the transverse foramina. I want you to also notice this superior articular facet for articulation. And then here's the dens. The dens is where the atlas can sit and rotate, where they articulate together. So here's another look at the axis, but now you can also see the atlas. And so the atlas is much wider here. And here's this little facet where this dens actually comes up, and this sits on top of it, and it rotates around. It articulates around. You can see the shape of it is different here. You can see the dens or also the odontoid process of the axis. You can see this one is bifid there, that spinuous process, but the atlas is not. Okay, that's important. I think that's all we need to go over here. We do have, well, we have those transverse foramen here, and we'll look at some more of these features in lab. So the thoracic vertebrae are much larger than the cervical vertebrae. And what time is lunch? It's at 12. So we have 12 thoracic vertebrae. And those actually articulate with the ribs. They're larger, and they're also stronger. They're heavier than the cervical vertebrae. And they have these long spinuous processes, and you can see here they slope downward. All right, and that's what articulates with the ribs, the facets on the sides here. And you can kind of see, here's the facet here for the rib right there for articulation, which means movement together. So the lumbar vertebrae are the thickest and the heaviest. Dinner is at 5, so there are 5 lumbar vertebrae. They do function in support, and they support a whole lot. And they are located in the small of the back. And I already said they had to support a lot more weight because they're in the center of the body. But if I was to put these all 3 out on the table, you need to be able to look at these, and you need to be able to look at these if the lab test is online. You need to be able to look at the picture and identify what type of vertebrae are they. Are they cervical, lumbar, or thoracic? So you need to know those common features that they all have, and then what distinguishes them from each other. This is a good comparison here, so this would be a good slide to study to know the difference between these and to be able to tell the difference, okay? You can see the transverse process there on the lumbar vertebrae is more horizontal, okay? So it sticks out. The body is big, and it's a big, thick body. It's got to carry a lot of weight, so it's got to be thick. The thoracic vertebrae still has a pretty good sized body, but its transverse process sticks up a little more. And then the cervical vertebrae are just light and tiny and delicate. They're very light. So the sacrum is a triangular structure. It's at the base of the vertebral column. It is 5 vertebrae that are fused into one bone. The spinous process of these vertebrae fuses to form a ring of what we call tubercles, and they have a dorsal sacral foramina along their side. Dorsal, always remember, is along the back. I think of a dorsal fin for a shark. And they have spinous processes fuse, and they form a ridge of those tubercles, okay? So those spinous processes fuse. On the ventral or belly side or front surface of the sacrum, there are 4 pairs of pelvic sacral foramina, and those foramina provide passageway for nerves and blood vessels, okay? And that forms the sacral canal. So the coccyx or the tailbone here is below the sacrum. It is the lowermost portion of the vertebral column, and it is composed of 4 fused tiny little vertebrae there. Interestingly enough, you have actually a tail as an embryo during 31 to 35 days. It's a vestigial organ. It disappears about 8 weeks, but that's really kind of interesting that there is actually a tail that extends off of that for a while. And then we have apoptosis that will come in and that programs cell death for that to disappear. For some people. Some people are actually still born with it because that doesn't occur. There's a problem there. So you might have been wondering what some of these problems I spoke of earlier were with the spinal column curvatures. Kyphosis, lordosis, and you're probably pretty familiar, hopefully you're not similar because that can be a problem, familiar with scoliosis, but kyphosis is excess curvature of the thoracic part of the vertebral column, and you wind up with rounded shoulders and kind of a hunchback. So that's the one there in the middle. Lordosis is sway back, okay? So it's lumbar curvature, and then you can have those, my son, I know he has a form of lordosis where it actually kind of, that lower portion just rotates this way a little bit, and even that small, minute difference can cause pain and problems because everything just kind of gets offset. And our muscles and tendons and everything, they're paired and they're in balance. And so when they're out of balance, we get lots of musculoskeletal problems that result from that. So the thoracic cage includes ribs, thoracic vertebrae, sternum, and costal or costal cartilage. It supports and protects the pectoral girdle, upper limbs. It helps function in breathing and protects thoracic and upper abdominal organs. So why is the location of the xiphoid process here important? What are the xiphoid processes? If you are an LPN student, you may already know this, or even a CNA, you may already know this, or if you've been trained in CPR, because that is the point where you're going to go two fingers above the xiphoid process there on the sternum to try to not break it. Sometimes you still do, and it's much better to break someone's xiphoid process than to let them sit there and die. So don't be overly concerned with that, but you do need to be careful, and it can actually go and rupture the spleen or the liver. So it is important to remember that little 2-finger above rule and know where the xiphoid process is. All right, so we actually have divisions for ribs. We have true ribs, false ribs, and floating ribs, okay? So the first 7 pair of ribs are the true. They're also called vertebrosternal. True ribs is fine. And I'm not even going to ask you numbers 1, 2, 3, 4, 5, 6, or 7. I really just want you to know true ribs, false ribs, and floating ribs, and to know what the difference is and be able to identify those on a skeleton, all right? These are important to understand, and it is important to be able to know which one is which, like between 2 and 3, for instance, because there are some medical aspects of that where it's important. It's also important to identify for listening to lung sounds and things, okay? So 12 pairs of ribs that attach to the thoracic vertebrae. The first 7 are true. The next 5 pairs are false ribs, and the very bottom ones are floating ribs, and that is because if you can see here in this picture, they're not actually attached. These attach directly to the sternum, all right, so true ribs attach directly to the sternum, false ribs attach to the costal cartilage, and then floating ribs don't attach. There is no attachment. So we do have some features of a typical rib that you need to know. A rib does have a shaft, and I'm going to do a poor job of drawing this, but let's draw kind of a typical rib. Okay, it looks more like a banana than a rib. All right, so you have a shaft, a costal groove, and we'll identify these in lab, an anterior or sternal end, head, neck, and tubercle, okay? So the head is what articulates with the vertebrae, all right? So the head articulates with the vertebrae. The tubercle is going to articulate with the transverse process of the thoracic vertebrae. So the sternum is what we commonly call or know of as the breastbone, and it is located along the anterior, well, you can't see that low, anterior midline of the thoracic cage. It consists of these portions, the manubrium, which is at the top, and you do need to know these, okay, the manubrium, and then you have the middle body here, and the lower xiphoid process there that we previously discussed. We have a few of these features in lab. I believe we have these here, the jugular notch, that one may not be there, but the clavicular notch, and that is where the clavicle attaches. And that should be, I believe, the end of the skeletal lecture, and you'll kind of have another one for lab as well. So I'm hoping, again, I'm telling you, study these every day. Make those little flashcards. You can, you'll take pictures of them all front and back, which is going to take some work, but telling you, if you'll make those flashcards, draw these out, and label these parts, you're going to know them. All right.